Let's do some new generation NCLEX question. They're not telling you anything anymore, but they will work you to the case and you have to figure out what is the problem. You're not going to be getting a diagnosis, they're hiding it. So let's do one of them. If you can figure out what is the problem. It's a common case, you've seen it before, right? Very, very simple case. It's a 45-year-old female, let's make it a female, went on a business trip, okay, to South America. So this is a 45-year business to South America. Stay there for like 5 days. Yeah, and just a vacation. After the vacation, returns home after 5 days. So a total of 1 week total travel. Right, 1 week travel time. When she got home, the spouse noted that she's always drenched with sweat in their sleep. Very, very drenched in their sweat. The clothes is all wet. What did she do? She put the air conditioning blazing air conditioning temperature, basically. So the temperature was way down, like put it like 50, 55 degrees. But still, the clothes is wet every time she wake up in the morning. You get a clue? So that's the key, that you have to start focusing on what do you think will be happening. 5 days, business travel, coming back, and you wet whenever you sleep, your clothes is completely wet. Even no matter what you do with the temperature, then she started complaining of fatigue. And stop eating, basically anorexic. She has no appetite. All she does is drink some orange juice. Then for 2 weeks, she realized that she lost like 5 pounds. Figure out 2 weeks, she lost 5 pounds. And the husband asked, what is going on? He said, yeah, nobody's denying any sick contact. I never get anything, any contact with anybody. There's no sick contact. Okay, no sick contact. That's what she said. So she went to Walmart and bought some temperature probe, thermometer, basically the disposable one. And I get a temperature was 100.1. So she took some Tylenol, acetaminophen, and then it felt better, you know. She continued to go to work, to stay going to work no matter problem. I never see anybody went to work normally, but she felt really tired. She keep on taking the Tylenol every day. That gives her some strength. So 30 days later, 4 weeks. 4 weeks later, 4 weeks later, she realized that the fatigue has not gone. Now, when she coughed, she saw some small blood in it. She feel like probably it's a sore throat, so there was a small blood in the cough. And continued to have nocturnal diaphoresis. Non-stop, no matter what she do. She's still worried, like, what is going on? The husband said, hey, you look like you've lost like 10 pounds within a month. We got to figure out what is going on. You get the clue? they're not going to be giving you diagnosis anymore because they know you can figure it out. But you have to like put the cases together, all our passwords I'm giving you, and then you can put it together and say, oh, I know what it is. You can give me some differential diagnosis, but you should be able to figure out what is going on by now. So what did she do? She decided to go see the doctor. So PCP 45 days later. The doctor took an history. There's no nausea, there's no vomit, there's no diarrhea, there's no abdominal pain. I mean, she denied any sick contact. She said, I never get close to anybody. Right? And the doctor said, okay, yeah, this is not, it's not normal. So let's get a chest x-ray. We get a chest x-ray. What do you think they're going to see? The doctor orders a chest x-ray, say, I got to figure out, it's been 45 days and you don't feel well. We saw some infiltrate. And he also saw some cavitary lesions. He said, whoa, what is going on? There's some cavitation on the chest x-ray. A little bit of effusion, so small effusion. You figure it out, that's what you will see on a chest x-ray when you get a chest x-ray after 45 days. Then the doctor said, well, I know you're not from South America, but you're from here. You're from Maryland. So what is going on? And he said, okay, have you had a live vaccine before? Injection? And he said, which live vaccine? I've had a bunch of shots. He said, do you remember if you had this vaccine before? Have you had this? They've been talking about it in the news. If you had it before, just let us know. This BCG vaccination. He said, no, we don't give it here in Maryland. They don't do that. We don't give these a BCG vaccination. So, well, and doctor said, well, then we got to do something about it. We have to do something about it. Based on what you're telling me, I need to do something about it. So what did the doctor do? Ask the nurse. Nurse, it's your job. He said, inject 0.1 ml of some solution. Okay, in the upper arm, in the medial aspect of it. Make sure the angle is 15 to 30 degrees. Okay, I don't want you to go deep. Stay intradermal. And when you stay intradermal, just use a 5/8 needle, at least 5/8 inch, and 25 to 27 gauge. Those are key facts you have to know. I know by now you figure it out. And what did the doctor say? Okay, what do you want me to do? I want you to tell him to come back in 72 hours. Come back for re-evaluation. So that's what the nurse said. That was the instruction. I want you to come back. I want you to come back in 72 hours because I'm worried about you. So they place the whatever they injected 72 hours. But the nurse said, no. I don't think we should go. We should not let him go because this is dangerous. So let's put this patient in a room. But we got to take some precautions. And then the doctor asked the nurse, what do you suggest? What do you suggest? So what do you think the nurse is going to suggest? He said, I'm not happy. Let's do some airborne precaution. Airborne precaution. That means what? we have to have a room with a side room. The main door has to be completely closed. You, the nurse, you wear N95. Patient, nothing in the room. But if we're going to get X-ray, yeah, you should put on surgical mask. You keep your mask on every time you see the patient. You can remove it in the side room. And this room has to be private. It's on. Nobody goes in that room. You make sure nobody go there. Otherwise, we have a problem. So the nurse said, okay, roger that, we'll do that. After 72 hours, the nurse look at the forearms, you can feel what? A palpable raised hard lesion about 18 millimeters. 18 millimeters. And the doctor said, well, we have a problem. What did he say? He said, if you are immunocompromised, I expect 5 millimeters. If you are high risk patient, 10 millimeters. But if you're a normal person, 15 millimeters. But this is 18. Therefore, I think you're positive. This is a positive test. And therefore, we have to keep you in isolation. So the patient said, oh, no way, no way, no way. I'm not staying here. You get everything wrong. And the doctor said, yeah, well, I'm not wrong. We have other tests we can do. This test we did is called this, the Mantoux test. Okay. It's the same as this, purified protein derivative test. But if you don't want it, he was arguing, he said, well, she was arguing, she said, what? I want another test to confirm it. And the doctor said, okay, we can get a 24-hour serum test. This is easy. Serum test, we can get it, but it's not confirmatory. It's the same thing as we've done. It's a blood test, it will come back in 24 hours. And what do you call it? It's Quantiferon. Quantiferon test, that one will come back 24 hours, but it's still not confirmatory test. So the patient said, I want that one first. That one came back and it was positive. Serum study was positive for Quantiferon. And he said, oh, okay, now we have right problem now. We got to fix it. So we got to do a confirmatory test. The nurse said, we have to do a confirmatory test. What do you think will be the confirmatory test? We need a confirmatory test. He said, okay, I need morning sputum. Morning sputum. Collect 3 of them in the morning. Make sure you brush the teeth and give you a clean morning sputum. And this was ordered, and the nurse collected the specimen. By this time, you know what you're doing. You're getting all the stuff that you need to know, all the things, indication for positive tests, immunocompromised, people who are healthcare workers at risk, and just normal people, isolation. He has Quantiferon test that was positive. He need a confirmatory test, sputum test, which is going to give us a culture. It will take some time to come back. Okay. Meanwhile, I want the patient to be on airborne precaution. Is you have 2 rooms, 1 room, and the room is designed like that. This is the main door that the patient stay here. This door is completely closed. This is the side door. I want you to go here, put on N95, and go to this room and see the patient. Keep N95 on, you come here, and then you can take it. When you get out, you take it off. Patient does not wear anything in the room, unless he's getting X-ray. She just wear a surgical mask. Okay, so the culture came back and it was positive. Positive for what? Well, what kind of organism was in it? I don't know. You just have to tell me what kind of organism was positive. You know, Mycobacterium tuberculin. Now, we have our diagnosis, right? Our diagnosis, this is what was positive. And therefore, what are you going to do? Somebody came in, travel 5 days, cough, anorexia, weight loss, diaphoretic, nice weight loss, positive Mantoux test, positive Quantiferon, positive confirmatory test after your sputum. Patient still an airborne precaution, and you have mycobacterium positive in the culture. What are you going to do? What are you going to do? These are 6 case study you expect. You have to go through all these pathway to be able to answer the question, all of them, right? So what are you going to do for this patient? The doctor said, okay, we have this is the situation we have. We have a positive, okay, PPD positive, and a chest X-ray is positive. This is what we have. We have a bunch of situations. If we were to have PPD positive and negative X-ray, I'll call you latent disease. And in that case, no isolation. We give you standard precaution. And what do? We put you on some medication. The medication, you have a couple of options. You have Rifampin base option. So this Rifampin base option means you take the Rifampin for 4 months, or you take Rifampin plus Isoniazid for 3 months. If you don't like that, we can let you take Rifampin derivative, Rifampicin, plus Isoniazid, what? Weekly for 3 months. That one for 3 months. Or we give you monotherapy with NIH for 6 to 9 months. Those are your options. But the problem we have, you have a chest X-ray that is positive. Therefore, you have no option. We have to do something a little bit stronger. You will need a quadruple therapy. And the patient said, "Whoa, what is quadruple therapy? What is quadruple therapy?" Where he said, "We're going to give you 4 antibiotics." And what are they? He said, "Well, we have Rifampin, right? We can give you Isoniazid in addition. And you may need another medication, a bigger one, Pyrazinamide, or Ethambutol. These are your medication. We can give it to you. And I know you've seen it before. But before we give it to you, I got to talk to you about them because they are dangerous medication. They can cause problems. So what can I tell? The client asks, okay, tell me more about it. So the nurse said, okay, for this one, Rifampin, well, all your secretion is going to turn orange, red. So if you wear contacts, you got to take it off and wear glasses. Okay. When you cry, it's orange yellow. When you urinate, it's orange yellow, orange red. Or sometimes we put orange yellow, but it's the same color. When you cry, urinate, and then your pants will be stained. So I need you to wear something to worry about so that it doesn't drain like that. And then birth control doesn't work. So I want you to use barrier method for that one. And he said, okay, thank you. And Isoniazid, I want you to take B6. Because if you don't take B6, you have pins and needles in your hand. That's your peripheral neuropathy right there. And then the Pyrazinamide, he said, well, make sure you have you drink a lot of water because your uric acid will go up and you get gout. So I don't want you to do that. So avoid some meat. Okay, red meat, so that you don't have gout. He said, okay. And the last one, he said, I'm going to schedule you to see your ophthalmology. Because you get some optic neuritis from it. So you got to see ophthalmology every 6 months. You say, oh, these are 4 medications. They're very, very strong. And then the nurse asked the doctor, I thought there was one more medication. Yeah, he said, yeah. We don't use it that much anymore. Streptomycin is aminoglycosylate because it's very, very poison. I mean, it has a lot of side effects because it's hearing problem, because it's your kidney problem. And it affects your liver too. So that's why we don't use it, but it's also there. It's very, very strong that we can use it. So this is the patient we have. Patient's in trouble now. Those are the medication we're going to prescribe for you. And then you have to follow all the instruction. They say, oh, there's more instruction? I say, yeah. Yes, there's instruction. Which one? Teaching. Absolutely. No alcohol. No, stay away from alcohol as much as possible. Otherwise, your urine will be what? Tea colored. You're going to look yellow. You're going to itch. You're going to have anorexia. And you're going to get tired. I don't want you to take anything that will medication that can affect your liver, like acetaminophen. You can take some Motrin, but acetaminophen, anything that can affect your liver, you got to be careful because you're going to get into trouble. And I want you to avoid it as much as possible. Your stool is going to turn color too, so don't freak out if you see a clay-colored stool. It's because you are affecting your liver And all these medication affects your liver. So don't do that. Don't ever do that. But before we give you the medication, we have to do something. A priority. What do you think? Before we give you the medication, I have to do something about it. We have to do something before you can start the medication. Otherwise, you're going to get into trouble. I got to make sure something works. So I got to make sure your liver works. So we need to get initial LFTs. And then we got to do this at least every 3 months. If you don't do it at all, every 3 to 6 months, we got to check your liver, make sure your liver is doing okay. And the patient said, okay, thank you very much. I've had enough of this. I'm okay. I'm ready to move on. And he said, when will this drama be over? Well, what do you think? When is my drama is over? Am I going to be over with all these problems? Yeah, you have to have a sputum test. 3 of them. 3 sputum tests, and they have to be negative before we can clear you. And you have to have chest X-ray that is normal. This is how we can clear you. You can go out, but you got to wear masks. I said, what else? There's more teaching. You wear masks. You notify anybody you are being in contact with to get tested. And that is the most important aspect. Your spouse needs to be tested. You got to make sure you take all the medication we've given you. If you don't take it, you're going to have a bad resistant bug, and we can take care of it. It's very, very important you take the medication. How can you let these patients take medication when they are in the hospital? What can you do to make sure they are compliant with the medication? Direct observation. You observe them, give them the medication, and let them swallow, and watch them swallow that medication. That you know they're compliant. This is the case. A full 6 cases, hopefully you make the diagnosis. I never give it to you. I give you all the things they will ask you. When you study NCLEX cases, this is the way you should approach it. You're not going to be getting diagnosis because they will try to hide it. You have to know that, oh, this is what they're talking about. And you keep on going, you stick with it. 45-year-old, South America, 5 days straight, came back, drenched with what? Sweat, night sweat, fatigue, weight loss, anorexia. Right. Took some time or think it's going to go away. Change the temperature, still stay there. That's the way NCLEX still try to hide the information. A month later, still going on. More anorexic. When they cough, now there's blood in it. Went to the hospital, PPD positive. Quantiferon is also positive. Chest X-ray shows cavitary lesions. All of them are consistent with the disease process. Patient was still in denial. What did they do? They do a sputum test. 3 of them, you collect it in the morning. You make sure they brush your teeth. Place in what? Airborne isolation. Next, wear N95. Client wear surgical masks when they're going out. But when they are in the room, they don't wear anything. The main door is closed. Next, wear surgical masks with care. Next, use the side door. There's no need to wear a face shield. There's no need to wear a gown These are all contact problem. Unless the patient has a wound, you don't do that. Patient get a monotherapy if they have a latent TB. That means his PPD is positive, but our chest X-ray is negative. They don't need any isolation. It will be on standard precaution. This patient had both positive PPD and chest X-ray. Therefore, you get a quadruple therapy. You get what? Rifampin. You teach them how to take care of themselves in terms of their secretion, orange color, yellow, and they have to be careful about it because that is telling you that's normal finding. What is the most important? She's female. She needs to wear a barrier method. No alcohol for all these drugs. And each of them has its own side effect. Isoniazid, peripheral neuropathy. So you give them vitamin B6. Okay, it's not B12, right? No more streptomycin because it's very toxic. Pyrazinamide causes gout. Therefore, you let them increase their fluid, avoid red meat and other things that can fall. And the most important is Ethambutol, optic neuritis. They have to schedule ophthalmology visit. Before they can be cleared, they need to have negative sputum ×3 and a chest X-ray. When you're going out, they wear masks. They have contact tracing. Make sure they're compliant. Tell them of alcohol. They should not drink alcohol. There's nothing like limiting alcohol. Absolutely zero alcohol and nothing affect the liver. Otherwise, they will have signs and symptoms consistent with the liver injury, jaundice, tea-colored urine, clay-colored, pruritus, anorexia, and fatigue. And when this patient come in and he has what? Flapping tremor, when the hand is outstretched, then you know something is wrong, right? When this patient come in with the flapping tremor, with the hand stretched, you know that something is wrong. What are you going to get? You know it, right? You need to check the ammonia level. And what would it be? It's going to be high. And what you do, what is your diagnosis? There will be fatigue. You have what? Change in mental status. There will be lethargic. Your diagnosis is what? Hepatic encephalopathy. Right? Hepatic encephalopathy. What is your treatment? Straightforward, right? This patient needs to be in ICU, right? They have to be monitored. And you give them what? What medication will you give if this patient come in with the signs and symptoms I've told you? Flapping tremor, lethargy, change in mental status, confusion. And when you get ammonia, it's very elevated. Your diagnosis is hepatic encephalopathy. What do you give this patient while they are in ICU to take care of this problem? It's straightforward, right? They get what? Lactulose. And you should be able to teach the nurse about what to look for when they give them lactulose. It's a laxative. What is the B-sharp moment? Something you intervene is what? You titrate it to 2 to 3 bar movement. Anything greater than 3 bar movement is a priority. And that's when you intervene. This is the case, end of the case. I hope you get something out of it. Short case, he has everything you know about this topic. There's no question that he can ask you that you've not heard in a few 30 minutes. Take care of yourself. Have a good day. If you want more of this, you know where I'm located at NCLEX. If you're not subscribed, you can subscribe. You can also join our membership. You get more content like this. Take care of yourself and have a good day. All the best of luck. Bye.